Hey, welcome to the channel Medhub. Today we're diving deep into a topic that's personal for so many of us. Cancer. It's a scary word and something we might not want to think about, but knowledge is power, right? Cancer can be challenging to detect in its early stages because symptoms are often subtle and non-specific. It can be easy to brush them off or attribute them to something else. However, recognizing early warning signs can make a significant difference in treatment outcomes. Being proactive and informed is key. So in this video, we'll be discussing 10 early signs of cancer that you should never ignore. Remember, this video is for informational purposes only and not intended to replace professional medical advice. If you experience any of these symptoms, it's crucial to consult your doctor for a proper diagnosis and treatment plan. Have you been noticing your clothes fitting looser, but you haven't been hitting the gym any harder or changing your diet? That's what we call unexplained weight loss, and it can be a red flag. We're not talking about dropping a pound or two, we're talking about losing a significant amount of weight, like 10 pounds or more, without even trying. This can be a sign of cancers affecting your metabolism, such as pancreatic cancer, stomach cancer, esophageal cancer, or even lung cancer. Pay close attention if the weight loss seems to come out of nowhere and isn't related to changes in your eating habits or exercise routine. Also, look out for other accompanying symptoms like feeling full quickly, even after small meals, or a sudden loss of appetite. If you're experiencing any of these, it's time to schedule a visit with your doctor. We all feel tired sometimes, especially in our busy, always-on world. But when fatigue sticks around and doesn't get better with rest, it could be a warning sign. This isn't your typical, "I need another cup of coffee" tiredness. This is feeling completely drained, even after a good night's sleep, and having difficulty mustering the energy to get through your day. Persistent fatigue can be a symptom of several cancers, including leukemia, colon cancer, and stomach cancer. Keep an eye out for extreme exhaustion that disrupts your daily routine. You might also experience shortness of breath even after minimal physical activity. If your fatigue is relentless and impacts your quality of life, don't brush it off. Talk to your doctor. Our skin is the largest organ in our body, and it can tell us a lot about our health. Being aware of any unusual changes in your skin is super important. New moles, changes in the color or shape of existing moles, or any sores that don't heal, those are all things to take seriously. These could be potential signs of skin cancer or even internal cancers like liver cancer. Pay close attention to any moles that are asymmetrical, have irregular borders, or have different colors within them. Also, be on the lookout for any yellowing of your skin or the whites of your eyes, known as jaundice. This can be a sign of liver problems, including cancer. And if you notice any darkening or reddening of the skin without any obvious reason, don't hesitate to get it checked out. Chapter 4. Persistent pain. Pain is our body's way of telling us something is wrong, but sometimes it can be tricky to pinpoint the source. If you're experiencing persistent pain, especially in specific areas, it's important to get it checked out. This doesn't mean every ache and pain is a sign of cancer, but chronic pain that lingers without a clear explanation shouldn't be ignored. For women, persistent back pain or pelvic pain could be a sign of ovarian cancer. Headaches that just won't quit, even with medication, can sometimes be a symptom of brain cancer. And bone pain or tenderness that's not related to an injury could be a red flag for bone cancer or other cancers that have spread to the bones. If you're concerned about any persistent pain, don't hesitate to reach out to your doctor. Chapter 5. Lumps or swelling. Our bodies are constantly changing, and sometimes we might notice new lumps or areas of swelling. Most of the time, these are completely harmless, like a swollen lymph node when you're fighting off a cold. But if you find a lump that persists or seems unusual, it's crucial to get it checked by a doctor. This is especially true for lumps in the breast or testicles, as these can be early signs of cancer. Swollen lymph nodes that don't go away after a few weeks, or any unexplained swelling in the abdomen or extremities, should also be brought to your doctor's attention. It's better to err on the side of caution and have it examined. Chapter 6. Persistent cough or hoarseness. We all get coughs and colds from time to time, but a cough that just won't quit can be concerning. If you have a cough that lingers for weeks, especially if it's accompanied by other symptoms, it's important to see your doctor. This is particularly important if you're a smoker or have a history of smoking, as smoking is a major risk factor for lung cancer. Be on the lookout for a cough that produces blood, or if you experience chronic hoarseness or difficulty swallowing. These could be signs of lung cancer or throat cancer. Any persistent changes in your voice that aren't related to a cold or allergies should also be checked out. Chapter 7. Our bathroom habits might not be the most glamorous topic, but, paying attention to them is important for our health. Any significant or persistent changes in your bowel or bladder habits could indicate a problem, including cancer. Keep an eye out for blood in your stool or urine, as this is never normal and requires immediate medical attention. Persistent diarrhea or constipation, changes in the size or shape of your stool, or an increased need to urinate, especially at night, are also things to watch out for. These changes could be signs of colorectal cancer, bladder cancer, or other digestive system cancers. Chapter 8. Unexplained bleeding or bruising. Bruising easily or experiencing bleeding that seems to come out of nowhere can be a warning sign that something's not right. While occasional bruises are normal, especially if you've bumped into something, frequent or excessive bruising without any obvious cause could be a symptom of something more serious. Similarly, unexplained bleeding from the nose, gums, or any other body opening should raise a red flag. This includes blood in your vomit, stool, or urine, as well as heavy or irregular vaginal bleeding. These could be signs of leukemia, gastrointestinal cancers, or other types of cancer. If you notice any unusual bleeding or bruising, it's essential to consult your doctor promptly. Chapter 9. Difficulty swallowing. We often take the simple act of swallowing for granted, but when it becomes difficult or painful, it can significantly impact our lives. If you experience persistent difficulty swallowing, also known as dysphagia, it's essential to seek medical attention. This could be a sign of esophageal cancer or throat cancer, especially if accompanied by other symptoms like feeling like food is getting stuck in your throat or chest. Painful swallowing, hoarseness, weight loss, and coughing up blood can also be associated with these types of cancers. Don't ignore persistent swallowing difficulties. Talk to your doctor to determine the cause and get appropriate treatment. Chapter 10. Fever or night sweats. Fever is a common symptom of many illnesses, but when it occurs without any other signs of infection or persists for an extended period, it can be concerning. Night sweats, which are episodes of excessive sweating during the night, can also be a red flag. If you experience fever or night sweats that aren't related to an infection or other obvious causes, it's important to see your doctor. These symptoms can sometimes be early signs of cancers like lymphoma or leukemia. Pay close attention to fever that comes and goes without explanation, or if you find yourself frequently waking up drenched in sweat, soaking your clothes or bedding. So we've covered a lot today. It's important to remember that while many of these symptoms can be caused by conditions other than cancer, it's crucial to consult a healthcare provider if symptoms persist for more than 2 weeks. Symptoms worsen or occur in combination. There's a family history of cancer. Early detection is key when it comes to cancer treatment, and it often starts with you being proactive about your health. Here are some tips for early detection. Know your risk, understand your family history and risk factors for different types of cancer. Regular screenings. Follow recommended cancer screening guidelines for your age and gender, like mammograms and colonoscopies. Stay observant. Monitor your body for any unusual changes and report them promptly. Healthy lifestyle. Eat a balanced diet, exercise regularly, avoid tobacco, and limit alcohol consumption. Early detection saves lives. By staying vigilant and seeking timely medical advice for persistent or unusual symptoms, you can increase the chances of successful treatment. Remember, when in doubt, it's always better to get checked out. Would you like to expand this into a detailed script or include specific cancer types for each symptom? Comment below. Don't forget to subscribe to the channel for more videos like this.